To everyone. Save a life with your bare hands. Cardiac arrest is the leading cause of death in the U.S., and 400,000 lives are claimed annually. 89% die without immediate intervention. 80% die at home or at someone's residence, which means someone could be present to lend a hand. Only 41% of cardiac arrest victims get the help they need. American Heart Association. Survival depends on immediate interventions of bystanders who are willing to take on the role as a provider. Today, you will learn the skills you can apply in a cardiac arrest emergency. You will also learn the science behind these skills and how they work. The reality is, if you need to give CPR, the chances are you're going to be trying to save the life of someone you love, a parent, a spouse, a friend. When put in this situation, most people are hesitant because they don't want to hurt the victim. In many cases, dispatchers can give step-by-step instructions and talk you through the skills you already know. The American Heart Association, or AHA, the 2008 guidelines, have shown hands-only and traditional CPR are equally effective in the out-of-hospital setting. The new AHA advisory statement says, quote, all people who see an adult collapse should use hands-only CPR without mouth-to-mouth. The AHA stands behind traditional CPR in all cases of infants and children's drowning victims and adult victims who are found unconscious and not breathing. The theory is, if the skills are simplified and less confusing, more people will act in an emergency. According to clinical instructor from the Spencer Hospital in Spencer, Iowa, quote, the patient has oxygen in their blood. They don't need a breath for 6 to 8 minutes. What they need is chest compressions to circulate that oxygen out to the organs. Jeff Messerol. When a teen or adult collapses suddenly due to cardiac arrest, the heart is no longer pumping and circulation has stopped. The heart and other organs can survive about 30 minutes without oxygenated blood. The brain cannot. The brain starts to die 6 to 8 minutes after being deprived of oxygen. With the implementation of immediate hard and fast chest compressions, the remaining oxygen can be circulated. This simple skill can double the chances of survival. Anyone 8 years old or older not suspected of having respiratory issues should receive hands-only CPR. The need for bystander-initiated CPR is evident in the numbers and the growing population of the elderly who are living longer. In this example, 54-year-old Howard Snitzer collapsed due to cardiac-related issues. Bystanders came to his aid, initiated CPR, and after a 96-minute marathon and 20-plus providers, this man's heart started beating. He stabilized and was later transferred to Rochester's Mayo Hospital. In the demonstration portion, you will take away the skills needed to learn hands-only CPR and potentially save a life. The 2 steps for hands-only CPR are, first, activate emergency response system. That's 911 in the US. And then push hard and fast in the center of the patient's chest. Placing the hands in the center of the chest will avoid anatomy that could be harmed. Pushing hard and fast to the beat of Staying Alive by the Bee Gees will give you 100 beats per minute. If you've had CPR training in the past, mouth-to-mouth is no longer recommended. A barrier mask or pocket mask is now the standard. The ultimate goal is to sustain a steady flow to the brain and coronary vessels until an automated external defibrillator can be used. This will provide electrical therapy that could shock the victim's heart into a viable rhythm. These are found in schools, in the trunks of many police cars, and ambulance crews carry them with their ambulance. When a person is stricken with a cardiac issue, time is very important. Early activation of the emergency response system, early CPR, and early defibrillation are the links in the chain of survival. Please take some time, learn these skills, and then show 5 more people what you have learned. Remember, the life you may be saving could be a loved one. Thank you.